Good afternoon, everyone. Thank you for joining us. On today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Director of Medical Services for the Office of Emergency Management, and Marlena Jackson, Interim Commissioner with the Milwaukee Health Department. County Executive Crowley, we'll start with you today.
Thank you so much, Catherine. So today I'd like to begin acknowledging that the United States has now surpassed 500,000 COVID deaths here throughout the country. And this weighs heavily, not only just myself, but I believe our whole nation. So my thoughts and prayers go out to everyone who has lost someone because of this virus. The COVID-19 death toll puts this disease among the leading causes of death right here in the United States. And in order for us to stop this virus from taking more lives, we must remain focused or getting more vaccines in people's arms. And I want to share how we're helping to make that happen on a local level. So this week, our Milwaukee County Office of Emergency Management moved this vaccination site to the Kosciuszko Community Center, which is located on the Milwaukee's south side. And to be clear, this is not a site where the public can make their own appointments. And like other sites, this is not a walk-up site. And so in the spirit of equity, Milwaukee County is taking an intentional approach to vaccinate our neighbors from some of the most underserved communities throughout our county. And so Milwaukee County's Department of Health and Human Services and many of its vendors will be calling seniors and other state eligible program participants to schedule vaccine appointments. And if an eligible participant has no way to get to the COSI site, staff will connect participants to transportation services that will provide a ride to and from the location. The site will be open for community vaccinations beginning this Thursday and throughout this vaccination process on Thursdays and Fridays. Again, I want to reiterate that this is not a public site. And so if you're already receiving county services and you meet the state eligibility criteria for phases 1A or 1B, we'll call you to schedule an appointment. Goal is to vaccinate about 150 people from this group per day. And as we get more vaccine supplies from the state, we will have the capacity to vaccinate anywhere between 400 to 500 people per day. The approach ensures that we work with neighbors first, like seniors, individuals with disabilities, and those who are receiving health and human services. And we recognize that many of our service users face technology as well as transportation barriers. And we hope our process will help break down these access barriers. Everyone vaccinated and eligible. County vaccination site is not the only option for these eligible program participants. People can still go to the health provider, a pharmacy, or a number of community clinics. If you would like more information about the vaccine, you can visit health.com or you can call 684-1064. That number 684-1064. I'm here to get vaccinated as well, but I'm not in it. Recognize tens of thousands of people at high risk of serious illness and high risk who should have access to this vaccine before me. But I want to stress that when it's your turn to receive the vaccine, I hope you choose to get it. And we must listen to the science and the data that shows the effectiveness of these vaccines. And we are all eager to gather again with our family and friends, but we can't do this until we receive our vaccinations and we achieve herd immunity throughout this community. So please do your part. And I look forward to when it's my turn to roll up my sleeves and get the vaccine. And I hope you'll do the same when it's your turn. And lastly, on this note, I want to express my sincere appreciation for the team at the Office of Emergency Management. They have done an outstanding job of managing COVID-19 testing and now managing the equitable distribution of the vaccine. So thank you to these incredible public servants at OEM for stepping up for all of us and our community. But I also want to invite all Milwaukee County residents to join me for my first ever State of the County address. Our county has faced its share of challenges this past year, and there's so much work to do towards our vision to becoming the healthiest county in the state of Wisconsin by achieving racial equity. And so I look forward to sharing more about where we are right now in Milwaukee County, but more importantly, what's ahead. And so this address will be live streamed on YouTube and Facebook live tomorrow at noon. So thank you for your time, and I'll hand it over to Mayor Beard. Mayor?
Thank you very much, Mr. County Executive. And I want to echo the words of the County Executive. Today is a somber day. We recognize over 500,000 COVID-19 deaths across the nation, 586 of which have occurred in our own city. I think the number 500,000 is very difficult to get your arms around, but to put that in perspective, during World War II, we had approximately 405,000 fatalities of Americans. We had approximately 36,000 in the Korean War and approximately 58,000 in the Vietnam War. So we have essentially matched the number of American fatalities from COVID-19 to the number of people, Americans, who died in World War II, the Korean War, and the Vietnam War combined. That's why I commend President Biden on his proclamation, issuing a nationwide moment of silence and a tribute to all who have lost their lives to this deadly virus. The American flag at City Hall will be flown at half staff until Friday at sunset in accordance with this proclamation. We're doing that because we honor the lives of the parents, the spouses, the children, the friends, and loved ones that we've lost. We will always remember them in our hearts because that's how we want to remember them. I am proud of this city for coming together through the hardships and challenges of the pandemic. We continue to fight with science through testing, treatment, vaccinations, and preventative measures like wearing masks and physical distancing. As a city and as a nation, we are tired and we are grieving, but we must have hope. An end is near. To reach that end, it's going to be very, very important for us to continue our vaccination efforts. It's essential that we increase our efforts to reach underserved groups. Vaccination rates for African Americans and Hispanics are unacceptably low. The Milwaukee Health Department is going to address this issue, and it plans to start mobile vaccination efforts next week on Friday. We've been in communication with the state, with the Department of Health and Human Services at the state, with the governor's office, and initially we'll be working with the Wisconsin National Guard. We plan to have 2 mobile vaccination teams here late next week, and we will ask for even more. We are working through the details on where these sites will start and how people will sign up. It's likely there will be a combination of pre-registration and on-site sign up at the mobile locations. Again, we've received very, very good cooperation from the state on this, from local churches and from locations willing to host these mobile vaccination teams. To remind everyone, the supply of vaccine has limited our ability to expand mobile vaccination efforts. That is going to change. Again, working with the state, we believe we'll be able to expand our mobile sites beginning next week, and we'll add on after that in subsequent weeks. The good news, again, is we are starting to see some increases in the available vaccine supply. We are also making progress in coordinating with the Federal Emergency Management Agency. And I want to commend Interim Commissioner Jackson for all the work she's done there, along with Dr. Tamaro and Dr. Parity, who have really, really worked with FEMA to try to get this partnership off the ground as well. The bottom line is that FEMA is ready to support and not duplicate the work the Milwaukee Health Department is doing to get people vaccinated. So we'll have more information there. We hope to have more information by Thursday on the education component of this. Again, we're working very, very closely with the state. The state has made it clear that it wants to begin vaccinating teachers on March 1st. So we're working very, very closely with them on that. The commissioner might have something to say on that. Otherwise, we'll have a lot more to say Tuesday. Finally, an update on our COVID-19 community testing numbers. As of Monday, February 22nd, we had 451 people tested at the ballpark. We had 99 people tested at the Northwest Health Center, 84 at the Southside Health Center. That's 634. If you've been watching these briefings know, that is considerably lower than we've had in the past. And so you'll see some changes at those sites because of the drop in demand that can be changed very, very quickly if the demand increases. But we still ask people to continue to follow the 3 W's. Wear a mask, wash your hands, and watch your distance. If you are feeling ill or think you may have been exposed to someone who has tested positive for COVID-19, do not hesitate to seek out free community testing. Commissioner Jackson will provide more of an update on our testing efforts in several moments. So with that, I'm going to turn it over to Dr. Weston. Dr. Weston?
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we have had 97,372 confirmed cases of COVID-19 in our community and 1,055 individuals who've died in Milwaukee County. Nationally, we saw the country surpass 500,000 COVID-related deaths, a number that, though we recently anticipated based on the trends, is nonetheless staggering in its impact. It's 500,000 people that will not be able to see the coming months when vaccine spreads widely, and 500,000 people that will not get to enjoy the return that we all wait for of a more normal way of life. I do think it's a hard number to wrap your head around. It's more than half the population of our county that have died, that equivalent. And to be sure, many had comorbidities. Many were older, many were unhealthy, but they were alive and they were living with their conditions, often living a full life. But because of COVID, because of this pandemic, now they are not. Shifting to our local numbers, we continue to see encouraging trends with decreasing cases, hospitalizations, and deaths. And the percent of tests coming back positive is lower than it has been at any other point in the pandemic. And so certainly this should provide us with cautious optimism. We've seen in some European countries that the numbers that they see, that we see, these trends are reflecting a combination of two different trends. Certainly a promising downtrend in the majority of cases that are from the original COVID variant. But at the same time, there's a precipitously rising trend in the background of the new B.1.1.7 or UK variant. Right now, we barely notice the increase in B.1.1.7 cases as they're rare. But in time, likely in the next 1 to 2 months, we certainly may see a much more significant impact as it becomes the more dominant strain in our community, in our state, and in our country. The best way for us to address this is simply to continue our precautions for now of masking and distancing, as well as vaccinating those most vulnerable as fast as we possibly can. And on that vaccination front, we're certainly excited to expand our Milwaukee County Office of Emergency Management vaccination operations. We've been operating near the airport for the last few weeks. We've been vaccinating hundreds of state-eligible county workers, EMS providers, and law enforcement personnel each week. Yesterday, we officially moved operations to the Kosciuszko Community Center on the south side in order to expand our operations, as well as to move closer to the center of the county to provide better access to our populations most in need. While we'll certainly continue to vaccinate state-eligible county workers, EMS providers, and law enforcement, we will be expanding this week to also provide vaccine to the vulnerable, older adult population who already receive services from the county. We aim to vaccinate hundreds per week, and with adequate supply, hope to expand significantly higher than that in the near future. We've seen inequities in the vaccine distribution in our community, as well as the rest of the state and the country. And this work at the Kosci Community Center is an example of the targeted outreach that we as a county are doing to address and overcome these disparities. And this is just the beginning. We're working with the health systems and with our health departments to provide information and tools and models to better understand disparities and target vaccination efforts to address these inequities. Additionally, we have several county-level programs being developed to further target underserved and vulnerable populations and ensure that everyone who's eligible for a vaccine and wants a vaccine has a pathway to get that vaccine. We're excited to continue developing these programs and share more details as they come together. Thank you very much. Stay safe, and I'll hand it to Commissioner Jackson.
Thanks, Dr. Weston. So I want to start by just going over our vaccination numbers for the City of Milwaukee Health Department at the Wisconsin Center. So this week, we plan on vaccinating 4,460 individuals for both first and second doses of their vaccine. Starting next week, we have requested to the state a total of 10,000 total doses. And that would be around 7,500 first doses and around 2,500 second doses. So that large increase of vaccine, we are hoping to really address our education and 1B group that will be eligible March 1st. We continue to have both Pfizer and Moderna here at the Wisconsin Center that we are using to vaccinate our populations currently. So many of you have heard, as of March 1st, there is a new group that is eligible for vaccines. That group is considered Group 1A, or excuse me, 1B, and the eligible individuals in that group include education and childcare, individuals enrolled in Medicare, Medicaid, and long-term care programs, as well as some facing public essential workers, some non-essential frontline essential healthcare personnel, as well as facility and residents in facility staff and residents in congregate living. So we know that that is an extremely large group of individuals that are now eligible as of March 1st, but want to be clear that the Milwaukee Health Department is going to be focused on teachers as our, education as our first group. So that would, so what I want to remind everyone when we talk about vaccines is that we know that it is going to take months to get through our vaccinations. We started this work a little over 6-8 weeks ago, and we are continuing to do more and more vaccinations every week. And then we anticipate we will continue to do more into April, May, and June. So know that as we move into these larger groups, if the first week of March is not your turn to get a vaccine or you're not able to get in, know that as a health department, we are moving through our groups. There will be more vaccine and we will get you in. Also want to just be clear too, to remind individuals, when we talk about where the identified eligible groups come from, there were really two aims in being very purposeful of identifying those groups. The first aim really was to address mortality and morbidity, meaning making sure that individuals who were dying or sickest, namely our 65 plus individuals, were vaccinated first, which is why the state worked with the pharmacies to really address the nursing homes as far as getting their vaccine. And then secondly is really to address the basic functions of society, meaning our safety and security, our healthcare personnel, and now as we move into our teachers and our essential functions. So there's really two avenues that are going on at the same time to make sure we're addressing both issues as vaccine becomes available. So in addition to that, again, we are working here in the health department and do plan on March 1st opening up to teachers, and we will have teachers in education. We will have more information about that on Thursday, what that enrollment looks like. It will be very similar to our current process as it relates to logging on to the Milwaukee Health Department COVID Vax website to register and schedule. And so we're just working on finalizing those plans. I do want to just take some time to talk about the mobile strategy as the mayor has shared. We are working in collaboration with our National Guard sites to implement our mobile vaccination clinics across the city. We will start next Friday, the 5th, and we will be working with just a few churches to start off. So really a soft launch on March 5th. Understanding that really the goal of our mobile sites is to address equity, to go into the community, to be in places where the underserved might not be able to get to the Wisconsin Center, or there might be some hesitation there. And knowing that that is the purpose of our mobile sites, we want to be clear that those mobile sites are going to be twofold. Some of them will be open, meaning that registration will be open to the public. And that information can be found at the Milwaukee Health Department website, and other sites will be closed, which means we are going to particular locations for that particular population that we have identified or worked with that community organization to identify as underserved or minority or whatever it might be. So some sites will be open, some sites will be closed. All of that information, again, will be at the Milwaukee Health Department website. And then lastly, I just want to focus a little bit on testing. So while we spent a lot of time over the last month or so talking about vaccinations, really as one tactic. to address and to fight COVID-19. We know that mitigation efforts, meaning washing your hands, watching your distance, and wearing a mask, is another tactic. But then we also know that testing is just as important as vaccinations, just as important as mitigation. And so, knowing that that is the case, we want to continue to encourage individuals who have been symptomatic or who are symptomatic or who have been around individuals who have COVID-19 to get tested. Making sure that we are being wise at the Milwaukee Health Department with our resources. We are changing our current hours at the American Family Field beginning March 1st, so Monday. And those new hours will be Monday through Friday, 11 to 6 p.m. We will continue to have both our Northwest and South Side clinics open from 9 until 2, understanding that if we need to scale back up, we have the ability to do that. And that is all the information I have right now. So I will turn it back over to Catherine.
Thank you, Commissioner Jackson. At the beginning of today's call, we were having some challenges with audio, so I'm actually going to circle back to County Executive Crowley to share updates about the Milwaukee County vaccination site.
Well, thank you again. But just so folks understand, we've moved the Kosciuszko, the vaccination site from near the airport to the Kosciuszko Center. And our Department of Health and Human Services will be working with community partners to identify those who are currently eligible in groups 1A and 1B that receive county services. We'll be reaching out to those vulnerable residents to make sure that they get access to this vaccine, because we want to make sure there's an equitable distribution. And so if you don't have transportation, when we contact you, we'll talk to you about that and make sure that we can provide that transportation. But, you know, we want folks to know that it's just not Milwaukee County. There are other places that folks can go as it relates to getting a vaccination. And so whether you are going to a healthcare provider, a pharmacy, or a community clinic for the vaccine, you should get connected. And again, if you are looking for more information about vaccines, please visit the website healthymke.com or call 844-684-1064. I'll repeat that number again, 844-684-1064. Back to you, Catherine.
Thank you, County Executive Crowley. All right, our first question is from Derek Rose with WISN 12, and it's for Mayor Barrett and Commissioner Jackson. He says, based on responses he's received from the Milwaukee Police, Milwaukee Health Department, and Department of Employee Relations, no one is keeping track of the number of first responders, especially police officers, who are getting vaccinated. If the city is making sure people who are not eligible for vaccine do not sign up and get in line, how is this data being tracked?
So I can address that. So what we are using, once you log onto the Milwaukee.gov COVID Vax website, there's a screening process, and that screening process yields you to be ineligible or eligible based off of the ways you answer your questions. And so, and we have worked with our system to make sure that those that are eligible, again, end up into a schedule. The reality is that we know this is happening across the city, across the country. There are individuals who are finding their ways into the site. We don't have a foolproof 100% site, but we do know that we are working very hard to make sure that when you go into the system that you are appropriately answering those questions. And when you get here, we are checking IDs. So we are making sure that the individuals who are scheduled are appropriate when they actually get to the site.
There is a follow-up question from Derek, and he said, and it's for Commissioner Jackson and Mayor Barrett, asking how the Milwaukee Health Department revealed through open records requests on a number of weeks the allotment of vaccine that the Wisconsin DHS said Milwaukee Health Department was being allocated did not match the number that the Milwaukee Health Department actually received. How many weeks did this happen? Why did this happen? What is the city doing to get the vaccine the state said it would receive?
So I'll jump in and the commissioner can help here. There was a several week period. I'm guessing it was maybe 3 or 4 weeks. I don't know for certain, but where we would make a request and the state was not able to meet that request. And the reason primarily, I believe, is because of the supply that the state received. And so we have had many, many conversations now over the last week and a half with the state, with the governor's office. And now that the supply that's coming into the state is increasing, we feel much more optimistic. And I think the commissioner's statement about the allocation we're going to see next week tells you we think that the numbers are going to grow. So clearly there was, I think, a problem initially, but I think that that problem has been rectified and we're pleased with that. Nick Bohr had a similar question as to how many we could give. We could give, and I'll let the commissioner address this, we certainly could give more. But the fact that for several week period, we were not receiving the amount that we were requesting tells you that we were asking as much as we could. Now we both believe, when I say both, the state and the city, that we're going to be able to get a greater amount, and that's a good thing for everybody. Commissioner, I don't know if you want to add anything there.
No, I would just add that at the Wisconsin Center, we could at our peak do anywhere from 12 to 14,000 per week here.
Thank you both. And thank you for tackling that other question as well. So the next one is from Sharon Bajenda with CBS 58, and it's for Dr. Weston. She asks, some women have been told getting the COVID vaccine could affect their mammogram results due to a side effect having to do with swollen lymph nodes. Do you know about this, and what is your advice? Should women get their mammograms done before, a few weeks after the vaccine? Any updates on the Israel study that points that the Pfizer vaccine's efficacy is reducing spread?
Yeah, so starting with the first question about mammograms, there has been some evidence going around about this. This is a great example of the type of question that is critical to talk with your healthcare provider about before getting the vaccine. And there's a lot of questions that fall into this category. I have this condition, I'm on this medication, I have this allergy, should I get the vaccine? These are important questions to talk to your healthcare provider about and understand before going to the vaccination site, because your healthcare provider knows far more about your medical conditions, your medical history, and your medications than the vaccination site can. So try to get all those pieces together before you come to the site so that you're ready and able to get your vaccine. To the second question about the Israeli study, I think this is hopefully the first of many studies we're going to start seeing on this. And it's really, frankly, exciting to see this evidence coming forward. What the study showed is that people who are vaccinated have lower viral loads, even when exposed to the virus, than people who aren't vaccinated. And so what that translates to is that they're less likely to spread the virus. And this is really what we need to start getting back to life as normal, to start getting away from the physical distancing for those who've been vaccinated. We need more evidence. We need more studies with larger samples to really get the data. But this is one of the first studies that's come out, and it's really promising information.
All right, our next several questions are from Allison Durr with the Milwaukee Journal-Sentinel. I'll start with the first one, which is directed towards Milwaukee County Executive Crowley or Dr. Weston. And she's asking, how many total people receiving county services do you anticipate being eligible to receive the vaccine at the county site? And is the county receiving the doses from the state that it is requesting?
So I can start with this. So for the number of people that we're able to serve through this, for our underserved population who receive services from Milwaukee County, it's thousands of people, probably over 10,000 people that we'll be targeting, incrementally targeting, but trying to seek those individuals out in particular to try to help with the health and race and ethnicity disparities that we're seeing in our community. As far as our allocation, we continue as we ramp up our services to also equivalently ramp up our request to the state. The state has been responsive to that. I don't think anybody is getting as much vaccine as they want. And that's a national issue. I don't think anybody in the country is getting as much vaccine as they want. And the county certainly falls into that bucket as well.
Our next question is related to supply, and it's for Commissioner Jackson from Allison. She's asking, how much more vaccine is the city receiving that gives officials confidence that it will be possible to open the mobile sites next week? And how many doses are you anticipating allocating to the mobile sites?
So first, I just want to say that we feel at the health department that really addressing equity through the mobile sites is a priority. So whether we were getting increased numbers or not, we were going to be looking to start to pull off of our general allocation numbers that we have received so far in the past. Meaning, as we look to plan every week, we would naturally pull off what we felt was appropriate and what we would be doing for that mobile site. Again, really just to drive home the point that we are prioritizing our equity as part of the strategy of vaccinations. And so again, we've had just a few talks with our local and state partners around what we think we understand our vaccine allocations to be, and understanding that the state has received more vaccine over the last few weeks, which means overall we anticipate those numbers to increase as it relates to what we will get here in the city of Milwaukee.
The follow-up question is, would the federal government provide vaccine doses for the FEMA site, or would those come from the city's weekly supply?
So our understanding is that those would come from the state supply.
All righty. Our next question is from Gabrielle Mays with Fox 6, and her question is for Commissioner Jackson or Mayor Barrett. The DHS and Governor Evers announced today 4 additional community-based COVID-19 vaccination sites. Milwaukee isn't on the list. With Milwaukee having a high Black population along with other minorities, is that an oversight? What impact will this have on the Black population? Also, DHS mentioned FEMA. Can you talk more about FEMA, when FEMA is coming to Milwaukee?
Let me take the first part, and the commissioner can take the second part. Again, what we've been talking about today is the 2 mobile sites that we'll have here in the city of Milwaukee. So we're very pleased with our cooperation from the state of Wisconsin. That's going to allow us to get an additional allocation that, as the commissioner has said repeatedly, our focus is to deal with the equity issues with that. So the state has been very, very responsive when we've made this request for these mobile sites. So we're very thankful for the cooperation.
All righty. The next question is from Sari Lask with Milwaukee Business Journal. It's for Dr. Weston and or Commissioner Jackson. When do you expect Milwaukee and or Wisconsin will reach herd immunity? What is your definition of herd immunity percentage-wise?
I can start on this. So I think, it's hard to predict. I think our hope is that the vaccine supply that we're seeing right now, our hope and our expectation is that the supply we see right now will ramp up and ramp up considerably. And if it does, I think obviously we can reach herd immunity faster than at the rate we're going right now. So it's hard to predict. I would hope that, by sometime in summer, we get close to herd immunity. As far as a definition of herd immunity, we're probably talking around 80% of the population, certainly 80% of the adult population, to get close to that level where it's just so difficult for the virus to spread that we really bottom out the number of cases.
Derek Rose with WISN 12 has another question. He asks, how is the city deciding how much vaccine to request from DHS? Is it based on population, storage capability, or other factors?
So it is based on the population that we think we're serving at the time. So understanding what has been now deemed as eligible March 1st, and knowing what our current demand is for our 65 plus and our 1As, it's a combination of those two together and what we can then plan to do here at Wisconsin Center.
All right, Edward Ford with WISN 12 wants to know, Mayor Barrett, have you received a vaccine? And if not, when do you plan on getting it?
Well, that's a very good question. I received my second vaccine this morning. I got my first one on Groundhog's Day, so the 21 days have passed. So I was over at the Wisconsin Center this morning at about 10:15 and got the second one. I fall into the category of over 65.
Very nice. The next question is from Nick Bohr with WISN 12, and he wants to clarify with Commissioner Jackson, is the vaccine for the mobile sites independent of the 10,000 request for next week?
You're on mute, Commissioner, but
Thank you.
to that question, the vaccines that we'll get for the mobile sites is independent of the allocation we receive next week. That's my understanding, yes. And I think it'll probably be between 200 and 250 per site. So that's those 2 additional sites next week. And then we plan on asking for probably another 2 to 4 additional sites next week. So we're gonna ramp that up even more next week. So again, now that we've got this rhythm with the state, we think we're gonna be able to do even more.
All right, I'm getting the nod as well from Commissioner Jackson. The next question is from Sari Lesk with the Milwaukee Business Journal. And I believe it's a clarifying question for Dr. Weston. She's asking, is 80% about being vaccinated or also people who have been infected?
It's a good question. And nobody has the right answer to that. It's still to be determined. So what we do know is that the immunity provided by the vaccine seems to be very strong and durable or long lasting. The immunity provided by infection seems to be much more variable. It depends on people's immune systems. It depends on how severe an infection you had. It depends on a lot of different factors. And so the immunity from the vaccine seems to be the strongest and the most dependable. And we're still learning more about the immunity from infection.
All right, I'm seeing a few more related questions, so I'm going to group some. The first few are, what's the plan for FEMA and when will it help administer vaccines in Milwaukee? And will the FEMA clinic and the National Guard assist in supporting setting up the clinic?
So we are finalizing our plans with FEMA and our partners. We are hoping to have that support sometime in mid-March.
Thank you, Commissioner. We still have a few more questions. The next one is from Gabrielle Mays with Fox 6, and she's wondering, what's the upcoming plan as teachers are on the list to receive the vaccine starting next week? It seems there may be some special hours, locations for educators to get their vaccine.
So for the city of Milwaukee, we're working through those, finalizing those plans right now, understanding that we are looking to have specific spaces dedicated for our education group. That also includes our early child care providers as well.
And the final question that I'm seeing now is a follow-up from Derek Rose, and he's asking if you are able to share the locations for the mobile sites.
So I will be happy to share those next week. We wanted to just make sure that we have those spaces confirmed and those populations identified. So happy to share that next week.
All right, and another question, I won't say final, who knows, is from Allison Durr with the Milwaukee Journal-Sentinel. And she says, the racial disparities in the vaccine distribution have been discussed for weeks. Why is it that these efforts at the city and county are launching now?
Well, they're not just being launched now. They've been launched some time ago. But as you may recall, and I still will remember this, when we were told that the first allocation was going to go to the health providers, not to the city, that I felt at that time, because so many of the hospital systems are located outside the city, and so many of the employees for the hospital systems live outside the city, that right off the bat, that be a disparity, and there was. And you may recall that I made a special effort to try to talk about home health workers, because I felt that you would have more diversity, because that's a more diverse work group. After that, we were told, again, this is the federal guidance as well as the state guidance, to do the first responders. Again, you've got some built-in disparities there. Once we got to the 65 and older, that's when we felt that we were going to be able to start addressing that. But keep in mind, there remains a significant difference in life expectancy, even among that group. And so what we are seeing on full display right now is the challenges that we have because of the racial inequities that have been persistent throughout the healthcare system and society for many years. So now when we have this flexibility with the state, and again, the partnership with the state has been important, and they're starting these mobile sites, we believe that we can start really honing in on this. The center at the Wisconsin Center has been open, obviously, to the community. But we want to make sure that we're also going to places where people can be. So once we have this larger supply, we can start really, I think, making some progress. And that's my hope.
And here in Milwaukee County, as you all are well aware, we don't have a health department. So we were really focusing on those Milwaukee County employees. But as we begin to see more supply coming down the chain and coming into our Office of Emergency Management, we want to open it up. And we want to continue to open it up, but it really relies on how much supply we receive here in Milwaukee County.
And I would just add that as the mayor had shared, what we're talking about right now is the mobile sites and going out. But since the beginning of our vaccination efforts, we have made it we've been very intentional about making sure that shelters, which are typically populated and staffed by individuals of underserved communities in underserved spaces, are a part of our vaccination efforts, including our housing authority work, where we have been in constant communication with them and busing individuals from particular housing authority locations into the Wisconsin Center to get vaccinated. So that work has been continuing. We're just at a space where, again, as we open up to these larger populations, we're able to vaccinate more people and really be a little bit more focused.
Thank you, everyone. Those are all the questions I see in the chat. We appreciate your time. Media, thank you for all the important questions today, and we'll see everyone on Thursday.
Have a good one.
Take care.
Thank you, everyone. Thank you very much.
Thank you.